11 western states plug in to the Grand Coulee Dam. Its electricity powers our kitchens, classrooms, and offices. The world harvests grains, fruits, and vegetables grown from the water pumped here. Tourism flourishes on and around a lake that didn't exist prior to the 20th century. One facility, born at the same time, works to keep the people who live and work here in good health. Welcome to the only hospital in the shadow of the dam, Coulee Medical Center. The idea of a grand dam here goes back to 1892. It is conceived as a way to reclaim the vast Columbia Desert and turn it into productive farmland. It is born the largest producer of electricity in the United States and the largest thing humans ever built at the time. Construction begins in 1933.
But now the greatest wonder is in Uncle Sam's fair land. It's that keen Columbia River and the big Grand Coulee Dam.
Immediately, there is concern about how to provide health care to more than 12,000 workers and their families at the largest construction site in history. General contractor Mason, Walsh, Atkinson, and Keir, or MWAC, builds the region's first hospital in Mason City with 75 beds in 1934.
The dam being built brought tons of people from all different walks of life and all different areas. So we're different than some of the surrounding farming communities, some of the areas that are more established in agriculture, because we're here because the dam is here.
We'll revive and we'll prosper.
President Roosevelt visits the site in 1934. He can't imagine the dam's huge generating capacity will ever be fully used. But the country needs the work at the bottom of the Great Depression. Concrete pouring begins in 1935. In 1937, a contract to build a high dam is signed with 8 companies, among them Kaiser Construction. Kaiser creates a prepaid group practice at the hospital in 1938 and calls it a health maintenance organization. A plaque in the lobby acknowledges Kaiser Permanente, the largest HMO in the country, begins here. Grand Coulee Dam generates its first electricity in 1941 at the beginning of World War II. Its power produces aluminum, plutonium, and ultimately an Allied victory in the war. America finds peace and prosperity in the 1950s when Carol Netzel is a nurse's aide and Newark demands a uniform.
The nurses wore the full white uniform with the white caps, and the aides wore white dresses, not pants. Pantsuits hadn't been invented yet. And they were cotton, which meant they had to be washed every day and ironed and starched and ironed, the whole 9 yards. At any rate, it was a very busy place. We took everything that was thrown at us, whether it was a roadside accident or an industrial accident or a burn. We got patients from as far away as Inchlium because they had no way of handling them, and these were tribal patients. And of course, babies.
Mason City changes its name to Coulee Dam in 1943, and the hospital becomes Coulee Dam Community Hospital. The original hospital site is abandoned in 1962, and a new hospital, Coulee General, is built in Grand Coulee, where we know it today. Coulee General closes in 1965. Construction of a third powerhouse at the dam begins in 1967. Pauline Bryant, RN, and her husband Maurice, MD, are recruited to reopen the hospital.
The emergencies began coming in, and the hospital became, at one point during the construction, became so congested when we had patients in the hallway. That was rather bad. One of the nurses that I graduated from Sacred Heart with happened to be the director of nurses here at that time. And I remember we emptied her office and put her desk out in the corridor and had room for one more patient. And it was that busy.
The hospital closes again in 1972, reopens, and almost closes a third time in 1990. But area residents vote to create a public hospital district and take over ownership of the hospital themselves. The name is changed to Coulee Medical Center in 2009. CMC becomes a critical access hospital in 2001 and opens in a brand new building in 2011. This is the Coulee Medical Center we know today. It is true that Coulee Medical Center owes its life to Grand Coulee Dam. It is also true that many lives are saved by the dedicated people who answer the call here. Like on the day a group of boys spends a summer afternoon playing with a gun.
We had no Red Cross blood bank here. So started IVs with him. We had run out of ambulances that day. They had taken them into Spokane. So my husband called the sheriff and fixed up the back seat of the car. And I'll never forget this. I knelt on the floor of that patrol car. The mother rode in the front seat, and this is what kind of worried me. I thought, if I lose this child, you know, he had bled something terribly. And I had to change IVs at one point at about 100 miles an hour. That was wild. Some nursing experience that I've never had to repeat. But we made it into Spokane in just exactly 60 minutes. State patrol car went ahead of us to help clear the traffic. And that was quite a wild ride, I'll tell you. Sacred Heart was ready, and just as we pulled in, they had a stretcher, and they were ready to take him. And the boy, eventually, the great part of this is the boy did survive.
Not every call is life and death. Most calls are minor. In fact, just knowing there is a hospital here brings comfort. Tourists come here and retirees stay here because of community intention for wellness.
You know, if you have a hospital, people are more apt to come. And if they have people who are not quite well and they're visiting family or just being a tourist, you know there's a hospital here, you know there's an emergency room, that somebody's always there. And if somebody gets sick, they can bring them here. I think it's a big help for tourists to know that this facility is here and it's always open.
Those who have lived here in the shadow of the dam for a while know what it's like to not have a hospital here, to know the nearest help is more than 2 hours away. They can't imagine that ever happening again.
Well, no, I can't. I think that the people here appreciate the facilities so much that they would do almost anything to keep a hospital here.
Medical care is, of course, the service provided here. At Coulee Medical Center, that means a dose of medicine and a dose of care.
I think it's when you come in and you see the ladies smiling, that it's a nice place to be. And the greetings are pleasant, positive. This is where they take care of you and make you feel better. Where you expect to get better.
I don't know what we would do personally, what we would do without it. It's very personalized. They know you, they sitting out there, they ask how you are and how Bob is. It's wonderful. I don't think we could do without it.
I don't think it could be much better than this. I like it here better. I really do.
I think we were years ahead of most hospitals in having electronic medical records, electronic all documentation for nursing, electronic order entry for the physicians to put in orders, all things that lead to better patient care, better outcomes, decreased errors, because you have such as off-site pharmacists. So we can have 24-hour a day, 7-day-a-week pharmacy oversight on everything that we do because we do it all off-site and electronically. And there's just a lot that we can offer here.
At Coulee Medical Center, it's all about serving our community. That includes reflecting on our past, embracing our future, and knowing that we've got something pretty good here.
And they should celebrate it. It was some absolutely wonderful people that have developed the hospital, have kept it open, have reopened it, have fought for it, have blood, sweat, and tears over it, and the whole community. This is a group of just hardworking people, and I'm really proud to be part of it.